Welcome to Between Two Pastries, a not-so-typical nutrition podcast. Nicole and Annie are licensed and registered dietitians. Join them as they discuss hot nutrition topics, challenge popular beliefs, and have a blast doing it. Here are your hosts, Nicole and Annie.
Welcome to Between Two Pastries, everybody. This is Nicole.
Hey, everyone. It's Annie.
Today,
and I'm Dr.Vicki Mondloch.
Yes. And Dr.Vicki Mondloch is our special guest today. As a slight introduction, Dr.Vicki is a well-renowned OB-GYN. She has been in practice for 35 years. Is that correct?
Correct.
Time. She is a master at her craft. She has also authored a book called Full Bloom, which I have purchased and read and love because I feel like it's such an excellent resource for women to return to on a regular basis. And not only does she work with women, but she also works with men too. Dr. Vicki also has a radio show as well that she is working on that airs. Does it air daily or once a week?
It's a Tuesday at 11 o'clock Central Time show nationally. That's the national show. And then I have a local show on Joy Radio on Tuesdays at 2:30 and Sundays at 3 p.m.
So what we're going to do is in the show notes, I have a lovely write-up of Dr. Mondloch we're going to include, and then we'll include other ways that you can find her work too. So you can look for that as well. So Dr. Vicki, did you want to expand a little bit more on my extremely brief intro of you and tell us a little bit more about yourself?
I am a board certified OB-GYN, although when I started training, I started in internal medicine, switched to OB-GYN. So when I started in practice, I was very comfortable treating all of my patients as if they were my internal medicine and I was their primary. Mm-hmm. And that stood me well throughout my traditional OB-GYN, but I didn't realize how much better it would, trend for me when I left traditional OB-GYN, went into consultative and hormone balancing and wellness medicine, because all of my female patients would come in, we would hormone balance them, and they'd say, gosh, I feel so good. Can you do this for my husband too? Can you do this for my teenage daughter?
Right.
And it just took off. So I do primarily consultative primary care wellness medicine by hormone balancing my patients.
That's great. Yeah. Yeah. It's really great. And because I have had the opportunity to work with you firsthand, and I've also referred many of my clientele to you. The reason why I love your work so much is the amount of care you put into someone and the amount of education you put into someone and the amount of labs that you take. There are so many times when I am working with an individual and we're finding that they're having some different experiences, or the progress that we're trying to make together is starting to kind of stunt a little bit, or things are just becoming a little bit off. And then over time, and if they aren't working very closely with their physician on some of these things, and even if they are, I have found too that not every physician really wants to look at all the things. And that I find very frustrating because of, as you well know, but as I have seen with a lot of my clients I have sent to you, they unfortunately have had so many underdiagnosed, misdiagnosed, not diagnosed, not caught on the radar, things that have popped up that have actually created, an opportunity to balance. And provided answers to why they have felt so crummy.
Well, Nicole, if I can just add to that, I mean, we also have, most people are seeing a PCP. So it's possibly internal, but possibly just a general doctor who maybe had hormone education years and years ago or whatever. But oftentimes, even when labs are out of whack, they're going to go, oh, it could be this. Or what we tend to see is, I think you're intolerant to gluten, or you're intolerant.
Right.
All of a sudden is like this weird swing to things that are like, but that's vitamin D. What does that have to do over here with this food item? And so it again, we're going to a doctor, but it's not necessarily the expert in the field. And really it's your OB/GYN and your endocrinologists that are really hormone heavy, right? With education. So but it's not necessarily an easy thing for a guy to make an appointment with an OB/GYN.
Of course. Yeah.
I always tease them that they can tell their friends that they have an OB/GYN.
Yeah, right. So you're so unique in what you're doing, because you actually analyze lab results that I think most doctors are aware of, but they don't know the hormone base to everything.
Right.
Which is
And
huge.
And just to make it really clear too, we're not just talking about our sex hormones. We're talking about every single hormone, really, or not every single one, but you know what I'm saying? There's some really, really heavy hitters. And then we're also talking about some supportive labs too, because it also gives us information around how all of this is functioning together as a whole. And I think that's kind of the biggest piece that I just wanted to make, is that it is important to understand how this is all functioning as a whole. We can't just isolate and be like, oh, we'll just watch this little number here. That little number is because of X, Y, and Z that you're not catching, and that's the piece. So anyway, you're the guest and we're doing all
But you're doing a great job. Hey. Oh,
yeah.
Well, and to your point, Nicole, I love that lead in for me, because the way I present to my patients why I check the labs I check is I tell them, think of a 4-legged chair, and the 4 hormone groups that I'm going to check are the 4 legs of your chair. And think of sitting on a chair with a broken leg. Well, what happens? Well, if you don't know, you're going to land on the floor and then go, oh my gosh, I'm on the floor. And you dutifully rewrite the chair and you sit back down in the chair and you land on the floor again. So until you realize there's a broken leg of your chair, it's Groundhog Day. And you keep doing the same thing over and over again. Even if you know you have a broken leg of your chair, you're going to sit very gingerly on that chair.
Right.
So if you're sitting gingerly on that chair, can you really concentrate on getting something else better, like weight loss? Can you really concentrate, have your body concentrate on weight loss if you're gingerly sitting on that chair and it really isn't, your body can't think about anything else except balancing on that chair?
Right.
So
good point.
So I explain to my patients the 4 different hormone groups, the 4 legs of your chair. And you're absolutely right, Nicole. The first leg is your female, male, or for guys, just their male hormones. But for women, it's female and male. The second leg is your thyroid, and it's not just your TSH or a reflex T4, it's all of your thyroid panel, including your antibodies. And your third leg is your adrenal, which is your cortisol supported by your vitamin B12. And whether or not you may have trouble methylating, which would be a genetic defect for a gene called MTHFR. Your fourth leg is what many people never even realize is a hormone, and that's your insulin. And you go, insulin is a hormone? What? It is. And that ties to your blood sugar and to your hemoglobin A1C, and whether or not leptin, as your quote unquote fat hormone, is really something that's working for you or not. And your stabilizing leg is your vitamin D. So all of that goes into the foundation of your health. So if you're not looking at the 4 legs of your chair, you're missing basically your whole foundation. You're missing it.
What are some of the top things that you find come through your door?
Well, it's really a wide range of symptoms that people walk in with, but they don't understand that it all ties back to their hormones. Let me give you an example. You may be a 20-year-old female who comes in and you can't not only lose weight, but every time you go on different diets, you're gaining weight. and you're starting to get sideburns and you're getting acne and your PMS is out of control and you can't sleep well and you're having muscle aches and you pee every 15 minutes and you go, but I don't have bladder infections. What's going on with me? And those are all 3 hormones that we check for women as far as sex hormones, your estradiol, your progesterone, your testosterone, and that may signify polycystic ovary. But that may also signal something going on with your insulin department. You may be insulin resistant. It may also trigger some gluten issues, and it may or may not even be associated with thyroid. But that may be very different from a 35-year-old woman who walks in and says, I have irregular periods, but when I have them, they're really heavy. I'm not sleeping. I'm having PMS that's all month long, not just the week before. And I'm losing hair. What's going on? So again, all 3 hormones are being impacted, your estradiol, progesterone, testosterone, but now you're in your 30s. So it's a little different picture, and it actually may be hormone swing of a 30-year-old female, but stress may be a factor, again, hair loss.
100%.
Now you may have a 45-year-old woman walk in and she goes, my body just betrayed me. I knew exactly what to do to keep my weight where I am. I put on 30 pounds in the last 2 months. I can't fit into anything, and I'm basically eating balanced and my hair is falling out, and I can't sleep, and I'm getting hot flashes. And it's like everything that she could list, which sounds different than the 25-year-old, is now in the 45-year-old, but it's all hormone. It's just where is that hormone on the bell curve of a 20-year-old, a 30-year-old, a 40-year-old? And they're all related and relatable, but different to each patient. And that's the key.
And I think that kind of ties in with what so many of my clients will come in struggling with too, is they're pushing so hard and they're doing this and they think they have to continuously basically eat nothing, right?
And work out all the time.
That's what I mean by the pushing, the just constant workout or the super high heart rate stuff, or I have to do more. I can't do more. I don't know how to do this. And on top of that, I'm exhausted, but they feel like there's no other way. And it's trying to help them understand that until you can get these pieces balanced out, you're not going to be able to force your body to do the thing you want it to do. And I can't really stress that enough.
It's almost as if your body is screaming at you and it's in a different language and you can't understand the language, because what women are never shown is that your hormone levels will go up in your 20s. You'll have variation in your 30s. You'll have another variation in your 40s. They do this.
Right.
But the basic pattern is a bell curve. And we kind of intuitively know that, but nobody tells us the symptoms that go along with changing hormone and what that really translates to for each and every one of us.
Right.
Well, I think society is telling us what hormones do, and it's food's fault. It's you need to exercise more. It's weight. I think we've demonized not only food, and we've demonized hormones in our body, such that something must be wrong with you, because you should just be able to eat salads and look this way and exercise all the time and be thin and totally fine. And we forget that our physiology is different for every person. We all are very different and our hormones act differently. But we also forget that, like, we might eat well and exercise and our hormones might all be fine, but that doesn't mean we're going to change the way we look.
Yes. And I was just going to say, Annie, when you had started talking about all of that as well, is that so many women are just like, why can't it be like it used to be? Why can't it be like when we're in our 20s? Like they want, like or even they'll even go back to high school. But the thing is we cannot compare. We can't even compare. We can't compare ourselves to someone our same age. We definitely can't compare ourselves to someone who's 20, 30 years younger. Do you have people coming into your office, Dr. Mondloch, saying, make me how I was when I was X age?
Yes.
Yeah.
Yes.
Yeah.
And most of those patients are actually my menopausal patients.
Sure.
They'll come in and they'll go, I either sailed through or didn't sail through menopause well, but I thought I handled that 2-year period really well when my periods were goofy. And then I got over to the other side and thought, oh, I made it. And I did okay for a while, but then I just don't feel right and they can't put their finger on it. So I have a symptom sheet for them to mark. And inevitably, and again, we're all different, but the common themes are that they're not sleeping well, that their muscles ache, that they're fatigued, that their bladder is either leaking when they laugh or sneeze, their libido is in the toilet, they feel moody, they feel bloaty, they feel headachy, and they just can't get a handle on their weight. And that weight thing, we're so conditioned that we have to look like the Hollywood picture of the perfect woman at our quote age, that we get lost in the fact that this is your body that's changing and you simply need to know what you can do to help. So in my menopausal patients in particular, they'll say to me, well, hormone, I don't need that. I'm past that stage. That ship has sailed. And my answer to them is, well, let me give you a quick little 3-minute kind of explanation. Is the average age that women lived to in 1912 was 48 and a half years old.
Oh, wow.
Think about that.
Yeah, for sure.
That means nobody even experienced menopause.
Yeah.
Or 1912. It just didn't exist.
Yeah.
So really, it's about 100 years old. That's it. Okay. Our life expectancy now is a little bit beyond 48 and a half. We're like at 70. And for many women, they're living into their 80s and 90s very, very well. So think about this other next fact. If our body makes hormone from puberty to menopause, which average age is 50 and a half, so 12 and a half to 50 and a half, why is it so good for us there? And from 50 and a half on, it's the devil. It's a demon. It's horrible for you. It's going to cause all sorts of problems and whatever. Wait a minute. Let me think this through logically. If it was so good for us then, why is it so bad for us afterwards? And that's partly the message that medicine fabricated, because they did this wonderfully, they thought, elegant study called the Women's Health Initiative, but they didn't study bioidentical hormone. They looked at the wrong hormone and they can't admit that they blew it. Right. So instead of saying, gee, we should really redo this study because it's expensive to do big studies, we'll just throw women under the bus. And they're used to it. They're resilient. They can handle it. So we'll just tell them hormone is bad for them and we're off the hook. And I call foul on that because it is our life's blood. It is our moxie. It is what makes us us. So when I talked about the 25, 35, 45-year-old that comes in, let me tell you about the difference between a 55-year-old who goes, I'm having irregular periods, but I'm menopausal here and I'm premenopausal there, and I'm all over the map. And by the way, I've gained 20, 30 pounds and I can't get rid of it. Well, that person needs hormone back in their life, but not at the levels they did when they were menstruating. Now take the 65-year-old who walks in and goes, doc, I love my husband, but I just have no interest. I just don't understand why I can't have, make love with my husband, feel the way I used to feel, and keep my weight off and sleep at night by the way I'm having issues with my muscles and every joint in my body aches,
Right.
and I'm losing hair, and the ands just keep going. Then the 75-year-old comes in and goes, I just don't feel good. And until you put a symptom sheet in front of them, they really can't even put their finger on what I don't feel good means. So
Well,
we all have something. Yeah, we
Yeah.
all have something at different stages, is my point.
Yeah. And just to add to that, I think what's important is that women are so used to accepting that they don't feel great.
Right.
And
Right.
that, well, that's just what it is. Or do you know what I mean? Like there isn't a way we can feel better. And so I think that it's just great that there actually is a way we can feel better.
We're conditioned to hide our periods. We're conditioned to hide menopause. We're conditioned to hide our weight. We're conditioned to be resilient in no matter the amount of pain that we might be in, childbirth, whatever it might be. It's ridiculous.
You
Put
have
a
to
smile
smile
on.
and be happy through it all. Right.
Absolutely. Absolutely.
Right.
So I just want to share a little bit about, I haven't really shared my whole entire story, but I just want to share a little bit with how I got connected with you, just because of the fact that so many of our listeners may be going through something similar. And so I'm trying to remember how long ago it was, but when I had, I was in a very, very not great place health-wise. I was probably about 89 pounds, definitely had the female triad, which nobody really knew at the time what that really was. And when I went to seek out help with, I need to feel better, I'm having a lot of these other symptoms, it was very interesting because I was treated so much like, oh, but you're so fit. What? I'm a skeleton. My resting heart rate is 40. My blood pressure was almost non-existent. And they're like, oh man, you're just the star of health. I'm like, I could have a heart attack. I've been palpating like every day, which is why I'm here. And then the diagnosis would come in, oh, you just have subclinical hypothyroidism. Just eat a little more. Okay, wait. This is not okay, because I've also not had a cycle for 7 years. And now I'm osteoporotic. Oh, well, we'll just give you an infusion for that and that'll be fine, which made me feel sicker. And then my neighbor, bless his heart, had actually introduced Dr.Vicki to me. And then this is when my world expanded to go, oh my gosh, there's so much more here. And so many people are missing out on really knowing what's going on with their body. And so then after working with Dr.Vicki, I literally brought myself back to health with her help. I had to go through puberty all over again. It was very uncomfortable, but I got through it. When people, we work with a lot of people, we have a lot of listeners who, again, might be doing things too far and are actually getting accolades from their medical professionals that they work with. And this is what I'm trying to say is, if they're getting accolades, but there's a part of them that knows they don't really feel right, or they're having anxiety, or they're not sleeping well, or you know what I'm saying, they're having all these other things, they're not talking about it because they're getting so praised from some other, there's no voice there, and there's an absolute disconnect, and they're going to continue hurting themselves along the way. So I wanted to share that just because, you can get help. You can also move through that whole thing if that is something that somebody experienced, whether it's the female triad, or for men and women, it's now called REDS to include men, because there's so many more men that are experiencing this as well. What kinds of things do you see in men? And I don't know if you see some younger men that come through, because I certainly have seen some younger men that could benefit from working with you.
Oh, absolutely. And the biggest thing that men think their hormone is there for is, of course, what happens in the bedroom. But when they
Yes.
start realizing that they come home from work, they hit the couch and their wife is mad at them
Yeah.
because they're asleep and they can't participate in family life. They're not there for anything that happens at home. They
Mhm.
simply get up from the couch, go to bed, get up in the morning, work, and that's all they can accomplish in their day. They don't realize that their muscular aches, that their oversleeping, that their moodiness, that their loss of hair, that their issues with sore muscles and short-term memory loss, brain fog, that's all relatable to low T, but nobody talks about
Right.
that aspect of low T.
Right.
But it's all, or at least many of the same issues that women have. They just don't have periods, even though we kind of all joke that guys go through their cycles just like women do.
Oh, sure. Yeah.
And
Mhm.
but they truly, if they get their levels checked, and I'll give you an example, a mechanic who comes in and he's putting in 12-hour days. Well, you're on your feet. You're many times hands over your head and you're doing physical pulling and yanking and you're just physically on your feet. So that's just a rough day. You may or may not get your 3 meals in. Likely you're missing lunch. So by the time he gets home, he not only hits the couch and is asleep, so he's, basically missing dinner, but can't perform in the bedroom. And that's really why he comes in, because he can't perform. And he
Mhm.
thinks this is just ED. But when I check the level on this 35-year-old mechanic and it comes back at the level of an 80-year-old man,
Absolutely.
that's quite a discussion. And his eyes just pop and he goes, "What?"
Mhm.
Mhm.
He doesn't even know what to say at that point, because yes, you have T, but you don't even register close to where you should be age appropriately.
Yep.
Right.
And that's the other key for men and women, is that you may have levels that register, but are they age appropriate for where you should be?
Sure. Yeah, totally. Totally. Mhm.
So
And
then
then
with guys too, it's their thyroid and their adrenal and their vitamin D, and they have to have the whole picture looked at too, with their insulin and leptin too.
absolutely. And I just wanted to make mention too, and I don't know if you see this, but there's unfortunately so many advertisements out there for specific supplements or testosterone like things available. And I just find that to be an incredibly dangerous thing, that's not something you want to necessarily, be messing around with. It's not like just taking a vitamin C tablet.
Right. And a lot of them are actually very energy intensive, so to
Oh,
speak.
interesting.
Yep. And they may have a lot of vitamin B12 in there. Again, energy specific. They may be very saw palmetto intensive, which is meant for that older gentleman that may have an enlarged prostate issue.
Mhm.
But a lot of it is very energy intensive. And that
Yeah.
can be not only confusing, but dangerous if somebody is also using other energy supplements like caffeine or monster drinks or any other, um, shall we say, caffeinated product. And especially then if they think, oh, now I need to use something to help me relax. And they go
Right.
from one extreme to the other extreme and think that that's how their day should go, is bouncing
Right.
between extremes.
Right. Right.
Mhm.
Again, just creating more imbalances when embarking at that kind of route, which only just means how important it is for people just to reach out and get some real help around that. As we're kind of wrapping up with time here, you really had wanted to talk about the kind of medical team that you would like to encourage people to be seeking.
Well, and the reason I say medical team is most people think that they have to belong to a hospital system, or they have to go to a clinic that has all of the services that are right there that are surrounding them because that way they're going to be able to easily access any of the resources that their doctor or healthcare provider may recommend. Well, I'm here to say that as an independent doctor, I can choose my health team. I can choose a Nicole who may otherwise not be available to you because that's not the healthcare system she works for. Or I can choose a very specific exercise physiologist / PT / acupuncturist, because that person is going to be able to do 3 different things for my patients versus now those are 3 different areas that in a system you're going to see and you get who they have. So know that in an individual physician practice, we have the same team concept of putting the patient in the middle, surrounding the patient with the team of people that they need to make their health experience the best it can be, that it doesn't always mean it has to be from a system.
Sure. Yeah, absolutely. So again, just to review, we will put as much of this information as possible in the show notes, and a way to contact Dr. Vicki as well. And before we talk about any final thoughts, we always like to ask our guests what their favorite food is.
You're going to laugh at this, but I'm a sourdough bread baker.
Oh,
so
that's fantastic.
It is, because I get to be creative with it. So my favorite, and you'll laugh at this, my retired husband, who's retired engineer, is a off the beaten path research brewmaster for one of the local brew houses. And he loves coming up with new recipes, different recipes, and he'll make the small scale of it, bring it in, have 3 iterations of it, and then they choose which one they like, and then they do a bigger batch of it, which is just keeps him happy. It keeps him occupied, whatever. But what I love is he'll bring the spent grains back home, and I can put that in my bread, and I can experiment with adding different things to my sourdough rye or my sourdough pumpernickel or whatever. So it's my way of being creative with having bread that I can control. I know where it's coming from.
That's so cool. Super fun. Yeah, definitely. Do you use a bread machine for that, or are you making that?
Nope, I'm doing it completely by hand.
Yeah.
So the old-fashioned way.
Good. That's so fun. And any final thoughts for you, Dr. Vicki, that you want to share?
Well, I guess the final thought is, if you think at all that there may be an issue that you have, it doesn't really cost you anything except time. Your labs will be covered by your insurance. So, and if they aren't, we have a 90% cash discount program. So there's always a way that if you just feel like you're not where you need to be, then reach out and ask the question, am I where I should be? Because the only way to know is to know. And that's probably the best advice I can give anybody.
Well, thank you so much for your time today, Dr. Vicki. We so appreciate it. And we will let you know if we have any listeners who have follow-up questions or anything too, that hopefully they'll be following you on the different ways in which they can follow you too. So
yeah, and be sure to check out Dr. Vicki's book, Full Bloom.
Yes.
And my adolescent book, Blossoming.
Wow, I love
very
that.
Cool.
Yes,
which is really wonderful. Yes, awesome.
Thank you for the opportunity to be very much appreciated.
Have questions you want to hear discussed on the show? Find us on Facebook or visit between2pastries.com and drop us a line. Want to support the show? Find us on Patreon for exclusive content. If you love the show, find us on iTunes or your favorite podcast platform. Hit the subscribe button and leave us a review.